Hi, Dr. Harrison here, and today we're going to talk about back pain, which is the most common complaint that I see in my office. There are several different causes of lower back pain, and if you're watching this video, you may be suffering with lower back pain. So I just want you to understand our different approach to the different types of back pain, how we diagnose those or differentiate between those, and how we go about treating them in the office. So the most common cause of lower back pain that we see is just tight muscles and restricted mobility. So after doing our thorough consultation and examination, we would take some x-rays of the lower back to rule out anything dangerous that could be going on there. And on those particular films, when it's just tight muscles and restricted mobility, everything's going to look completely normal. So on the front view, all the vertebrae will be stacked in a straight line. We won't see anything rotated or tilted out of its normal position. Everything would look completely normal. On the side view, there would be that normal lordosis or curvature in the back. And again, that would look completely normal. So when we've ruled out all the dangerous things and everything looks normal on the x-ray, we pretty much know that we're dealing with just tight muscles and restricted mobility. That responds really, really well to just chiropractic adjustments, maybe some modalities if the pain level is bad enough. And by modalities, I mean muscle stimulation to help relax muscles, maybe ice to reduce inflammation, that type of thing. So pretty quick fix usually with those, anywhere between 3 visits, 9 visits. Usually most patients are feeling pretty good depending on how long that back pain has been there. But typically when we have tight muscles, restricted mobility, that's going to be a quick fix. The second most common type of lower back pain that we see is that tight muscle and restricted mobility, but now on the x-ray we see that something is either rotated out of its normal position, either one or more than one of the vertebrae, or maybe one or more of the vertebrae is tilted, so one might be laterally flexed on top of the other. Typically we'll see that when there's some swelling or maybe even some disc irritation, which are those pads that sit in between the bones and allow for movement. So in that situation, when we see those shifts on the x-ray, then we know we've got a little bit tougher job to do in restoring that lower back to its normal position. We're going to have adjustments and therapy that may run anywhere from 3 or 4 weeks on up to even 8 to 12 weeks, depending again on how long that shift in the structure has been there and how much deterioration or damage has been done to the joint. So again, on the x-ray, on the front view with that second type, we would see either a rotation or tilting. Maybe even on the side view, we might see a reduction in the curvature due to chronic muscle tension in there. So that's the second most common type of lower back pain we see. The third would be arthritic change in the spine. So on the x-ray, we would see bone spur formation, maybe calcium deposits, along with the tight muscles, restricted mobility. Usually we're going to have a shift in the structure when we have arthritis in there. Arthritis doesn't show up overnight, so this is something when we see arthritis we know has been developing for at least 7 years or longer. Before bone spurs, calcium deposits start showing up on an x-ray, it's been going on for 7-8 years usually. So I can gauge pretty well how long this problem has been developing in there by how much arthritis is present on the x-ray. Obviously, in this situation, we're going to have a longer-term treatment plan. If we're trying to realign the spine, get the mobility back to its best possible state we can, this will slow down the progression of that arthritis, but it's going to take some time. And by time in these situations, maybe 90 days, maybe even up to 180 days of treatment. So 3 to 6 months is not unusual if there's a lot of arthritis, depending on what the patient's goal is, of course. If it's just to get out of pain, we can do that too. But if they're really looking to get that spine back to its best possible state, we're looking at a protracted treatment plan. The fourth most common type of lower back pain that we see would be a disc herniation or a disc bulge. And on the x-ray, usually we will see a lateral flexion because the vertebrae above the disc that is involved will tilt to take pressure off of that disc. So the patient might come in with a list or leaning or tilting to one side or the other, because when there's disc involvement, usually the disc is irritated posterior and laterally, so either to the left side or to the right side. Many times we'll get numbness or tingling or pain in the legs, or if it's in the neck, down the arms. And this is obviously a more serious situation. We usually will be using modalities almost always with these patients: muscle stim, ice to reduce inflammation, maybe ultrasound to create some deep heat in the tissue to soften tissues so that we can get in and realign that structure, get the mobility back in line. There has been some confusion as to whether or not it's safe to adjust someone who has a disc herniation and a disc bulge. I can tell you I've been doing it for 20 years and we've never had an issue with it. Worst case scenario, it doesn't respond and we end up referring them out to the orthopedic, or we move on to spinal decompression, which is a great alternative to help you avoid a back surgery due to a disc problem. And I discussed those in detail on another video, spinal decompression and disc injuries in general. But most patients with disc problems will respond very, very well to adjustments, especially if it's a disc bulge or a mild herniation. Many times we'll have complete reduction of symptoms and they do just fine in the office. So if you're suffering with lower back pain, any one of these scenarios, please feel free to call the office. The consultations are always free. We'll sit down, we'll figure out where you're at, which one of those possibilities or combination of those is going on, and set up a treatment plan to get you back on your feet. Hope you found this helpful, and I look forward to seeing you in the office soon.